Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday. Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer, we will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're going to have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPARS protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen the top specialist in supporting cancer treatments. All three of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th at SMX Aura 8 a.m.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP, tapos siyempre mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na may natapakan pala siya. So probably yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously despite medyo may konting kamahalan, but then kung titingnan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo, kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. Ay, Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer. We will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're going to have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPARS protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen the top specialist in supporting cancer treatments. All 3 of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th, SMX Aura, 8 a.m.
I'm Sheila, and welcome to another enlightening episode of Simply Healed webinar. This program is proudly brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Simply Nature is an international distributor of food supplements made from unique strain of high-grade microalgae known as PPARS. Backed by scientific research, PPARS have shown remarkable benefits in supporting cancer treatment, enhancing general health, and helping to reverse metabolic conditions such as hypertension, diabetes, and high cholesterol. To quickly recap last week's webinar, we tackled a powerful topic entitled Beyond the Lump, Natural Solutions with Simply Nature. It was an informative session with plenty of great questions well addressed by our experts. Now, this week, we focus to deeply important theme because tonight's topic is entitled Support and Protect Your Kidney While It's There. Now, CKD or chronic kidney disease is a serious but manageable condition, and with the right knowledge, you have the power to take control of your health. In this interactive webinar by Simply Nature International and Simply Healed Medical Group, we'll guide you through the clear natural approach to understanding and managing CKD before it progresses. You'll gain insights into early warning signs, lifestyle strategies, and nutrition tips that can support better kidney function and overall well-being. This isn't just a lecture. It's a chance to connect, ask questions, and be part of the supportive community focused on healing and prevention. Real-life stories, experts' guidance, and actionable steps will leave you feeling informed and encouraged. Now, let this be the moment you take a confident step forward, protecting your kidneys and living a healthier, more empowered life. So without further ado, let's dive right in. We'll also have this called AMA or Ask Me Anything portion later, so please feel free to drop your questions on the comment section below. Now, leading our discussion tonight are two highly respected health experts. First off, it's an honor to introduce Dr. Jansen Kalalan, a graduate of St. Luke's College of Medicine, a diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Joining him is a successful entrepreneur and seasoned international speaker who brings deep insight into personal health and success. He is the CEO and founding director of Simply Nature International and the PPARS expert from Singapore. Let us all watch this video.
Hi everyone, I'm Shyan and welcome back to our program. Today we're going to touch on the topic of CKD, chronic kidney diseases. Now, we've been doing a few of these videos on this topic because CKD is a serious condition. And if you have it, you're going to be asking yourself this question: is it going to get worse? Will I end up on dialysis? What else can I do besides taking my medications? Today on our program, we're going to talk about how you can support and protect your kidney function while it is still there. Today, we're going to keep our discussion short so that you can ask specific questions of your condition in the Ask Me Anything segment of our program that follows immediately after this. So today, let's cover just three important areas. First, one thing that you can do naturally to support your kidney is to lighten the load of your kidneys. Your kidneys are your filters of your body. So over time, things like too much sugar, salt, or medication makes them work harder. So one important strategy is to lighten the load of your kidneys. And again, here I want to emphasize one aspect of the kidney that's really important. Your kidney cells are called nephrons. And when these nephrons, kidney cells, are damaged, they can still repair themselves. But when they are destroyed, you cannot make new ones. It's not like when you cut your skin, you can grow new skin. When you destroy your nephrons, you cannot make new nephrons. They are only and can only be created when the baby is forming inside the mother's womb. So after it's formed, the way the structure of the kidney cells, it's just impossible to make new kidney cells. God knows that, so when He designed your body, He gave you two kidneys. Actually, you can survive throughout your whole life with one kidney, which is why many loved ones often do the very noble thing of sacrificing one kidney and donate it to someone they care about, like their parents or their kids. The truth is you can survive on one kidney. Now, to make sure that you never end up damaging both kidneys and having to go on dialysis, the idea is to lighten the load. So eat cleaner, stay hydrated. Drinking sufficient water is very important to a healthy kidney. Now, cut down on processed foods. Use gentle food-based supplements over synthetic ones. You know, there are actually many books written about supplements that we take. For example, there is a book which is quite alarming. It's talking about the calcification of your body. Now, because many women experience osteoporosis or are afraid of osteoporosis, and we decide that we need to strengthen our bones, and we take lots and lots of calcium supplements. When we take lots and lots of calcium supplements, this is occurring at an unnatural level. And one result is kidney stones. Food has been something that we have adjusted and adapted our bodies to process over thousands of years. For example, if you eat too many carrots, what happens to you? Your skin can actually turn orange, okay? But all you need to do is to cut down your carrot intake, your beta-carotene intake, and then guess what? Your skin will revert back to its normal color. So our body is able to handle what occurs naturally. So actually nature is still better designed to be accepted by the body, and if you eat too much, the body is able to displace it naturally. Now, how does the body remove the too much that you have eaten? It removes it through your kidneys and your liver. So the kidney is responsible for taking things that are in excess from your body. However, the kidney is not designed to remove things that are synthetically created. Can it do it? Yes, but can it do it well? In the short term, yes, but you don't want to tax it too much. Another good example of this is that if you put a paper bag under the ground, you bury it, maybe 2 weeks later, if you dig the ground up again, you know what? The paper bag has rotted and it's gone. Now, if you put a plastic bag in the ground, a year later you dig it up, it is still there. Okay, now we have actually improved our plastics. We now have created plastic bags that are biodegradable, but they still don't compare to paper, right? You put a paper in the ground, you compare it to a biodegradable plastic. The paper just breaks down much more completely, faster, and is more beneficial to the soil, right? Compared to the biodegradable plastics. So this is the reason why when you're taking supplements, you want to take food-based supplements and not just scientifically formulated supplements, because those still contain artificial binders and ingredients, and that ends up taxing your kidney. I almost said liver, because these two organs actually go together hand in hand. Okay, now let's talk about item number 2. The very important fact is that diabetes is one of the #1 cause of chronic kidney diseases. Okay, why? Because high blood sugar damages the delicate blood vessels inside the kidney. And having high blood sugar is often combined, will also manifest in inflammation, all right, and also blood pressure. So these are like what we call the big 3. If you have high blood sugar, you will end up usually with high blood cholesterol. And when you have these 2, you will end up with high blood pressure. All these 3 illnesses go together. They are like the 3 musketeers of chronic metabolic syndromes. Now, how do they damage the kidney? High blood pressure is like, imagine your water filter, but you put a lot of pressure in your water pipes. It's going to tear the water filter. Why? Because it's pushing the water through the water filters too hard, too quickly. Now, what does inflammation and cholesterol and all that and high blood sugar do? It's like throwing sand into the water, and when the water with sand goes through the water filter, it tears up the water filter. It's like adding particulates into the water, and that's exactly what happens. It's adding particulates to your blood and the liquids that your kidney filters out. So again, that's like putting sand into your water filter. It will tear up the filter, it will tear up your kidney. it will damage your kidney all that much faster. Right? So you want to avoid taking synthetic supplements. You just really want to take natural supplements. Actually, all the supplements in your health store is natural. A lot of them say it's natural. So what do I mean by natural? Those of you who live in Philippines, I know we enjoy eating malunggay. All right, we use it for tinola, right? We put it in our tinola dishes. But how much malunggay do you put in your tinola dish soup when you make it? Do you put a whole big bag full of malunggay? No, you don't, right? Because it's hard to eat so much malunggay at one shot. But do you realize if you dry up the malunggay, one whole bunch like this, and you grind it up into powder, and then you press it, you know what? It can be pressed into as small as a few tablets like this size. What are we talking about when we say natural supplements? We are actually talking about like eating supplements like this, right? It's actually the actual malunggay. It's not part of the malunggay, it's the actual malunggay, right? You're not taking a vitamin C that's chemically created, all right? You're actually taking the orange that contains the vitamin C, right? So that's the natural that we want to move towards in today's world, right? In the past, it was chemically created. Now, it's extracted. So we want to do our very best to find supplements that are actually whole, okay? Whole foods, right? They are the whole thing and just condensed in a way that it makes it easier for you to eat large quantity of it without being sick of it. Like another good example is, one quick way to eat a handful of blueberries is to blend it into a smoothie, right? So in a way, that's a natural supplement. You're taking more apples, more orange, and more blueberries than you can eat physically by blending it into a smoothie, and then you just drink it. It's a lot easier to take. So that's the kind of natural supplementation that we're looking at. Okay, number 3. Since we can't reverse destroyed kidney cells, we can't grow new ones. The goal is to slow down the damage, right? Now, how do you do that? I already talked about it. It's actually linked to number 2. You can do this by managing your blood sugar, reducing inflammation, and supporting your cells at the root level. Okay, all these can actually be achieved by our PPAR protocols. And for healthy people without CKD yet, the best product that you can take from Simply Nature is our PPAR tablets. The extracts will fall into the category of extracts. Okay, so they are really for you when things are not going well. You're sick. Okay, you need super strong. You need to have extra levels so that there's a therapeutic effect. Your body kicks into healing mode. But when you're talking about maintaining a healthy lifestyle, all right, taking a supplement that you take every single day, all right, to help you attain that natural health, then it's really the tablets. Why? The tablets are the complete microalgae. It is not an extract. Just as I detailed earlier, when you're taking supplements for daily usage, you want to take the whole food supplements. You don't want to take just extracts, okay? Again, Simply Nature has a whole range of our protocol, from the tablets, which is for every day, whole food, natural supplementation, and then we have our extracts, which are for those of us who are fighting a specific illness and we need something more. We need to reverse damage. We need to boost immune systems to an unnatural level, as in the level that you will need in order to fight diseases such as cancer. Okay, so today I just want to cover these 3. I hope they are interesting. And the thing I want to leave with you is take action today. Okay, take action to slow down any damage that your kidney is doing. Change your lifestyle so that you lighten the load. All right, and with that, let's move to our Ask Me Anything segment, where we'll answer your specific questions.
Sir Shyan, for that informative discussion. I'm sure that many of you have picked up valuable insights from his talk, and I bet some of you have already questions in mind. Now, well, here's the good news. We've now reached the AMA, or Ask Me Anything, portion of the webinar. But before we dive into our questions, let's take a moment to welcome our viewers tonight. So starting off with Ms. Elena Robles Antonio. Hello po, magandang gabi. We also have here Miss Mavs Agot. Hello po. Miss Edna Aveyo. We also have Miss Cecil Pinlac, Catherine Camus Abelio, Glenda Almero. Wow, Ma'am Nessie Ocampo. Hello po. There you go. Thank you so much for joining us tonight. Now, stay tuned because we have a lot of important announcements for this evening. Now, at this point, of course, as I'd said before, let's not keep you waiting any longer. And I can see, yeah, that some questions are pouring in private messaging. Okay, so in today's world where so many health opinions compete for attention, it's very important to hear directly from the trusted experts. So to help us answer your questions tonight with clarity and authority, I'd like to welcome once again our lifestyle medicine doctor and integrative oncology specialist, Dr. Jansen Kalalan, and of course, the CEO and founding director of Simply Nature International, Mr. Shyan Lim. Good evening, Dr. Jansen. And good evening, Sir Shyan. Okay, there you go.
Hi, Sheila. Good evening. Yeah, sorry, almost lost my voice today. Hi, Doc.
Hello. Good evening.
Yeah, that was you last week. Last week, you were almost losing your voice.
Yes.
So my turn this.
All
All right,
well,
let's go, Sheila.
okay, just make sure that you two gentlemen have waters beside you, okay? All right, so for the first question thrown to us, actually, this question was thrown to us last week, but we weren't able to answer. So the question is coming from Mr. Christine Banog. What is the meaning of cystic lesions in the ovaries? Is it normal for women still having menstruation?
Yes, of course. No, cystic lesions in the ovaries. The ovaries have cysts. That's normal. Okay. The cysts that you found on your ultrasound, those are your egg cells. Those are your oocytes. No, that's the medical term. So they start out as cyst-looking structures in your ovary. That's how they evolve, actually. So every single month, no, you have these structures. Now, what's the difference between this and polycystic ovarian syndrome? With polycystic ovarian syndrome or PCOS, the you can find cysts, no, at the same size, same stage. Approximately same size all over the ovary. It's diffuse, no, in other words. So you have the ovary and it's all over the place. It's around the ovary. The normal cysts, no, that you have during your period, the egg cells, no, rupturing. Um, when you look at the ovary under the ultrasound, it's usually single. It's usually solitary only. Okay, it's different from polycystic ovarian syndrome, wherein on ultrasound you will see multiple enlarged cystic structures in your ovary. Then that is abnormal. Okay, so is it normal for women still having menstruation? Absolutely normal. Once you go into menopause, you won't have any of these anymore. Yeah, unless so for postmenopausal women, okay, if you find cysts in your ovary, then that is something uh abnormal. So you have to go see your OB to address this. Okay, so postmenopausal women, all right, take note of that. So for premenopausal women, it's going to be a little bit more tricky. So if you have some symptoms of polycystic ovarian syndrome or ultrasound, it's really confirmed you have multiple cystic structures, then best to go see your OB. Okay, but if you don't have any signs of polycystic ovarian syndrome, and on ultrasound it was just a singular cystic structure, and on the impression, no, you would be able to read, no, that it is part of the ovulation, or part of the ovulation cycle or ovulation process. So that's nothing to worry about.
All right, that's very encouraging. Sir Sean, would you like to add anything? All right, I actually have a very quick question or follow-up question on that, because you've mentioned that if we found something that's solitary or just alone there, what could be our sign that we should worry? Is it something about the size of it, or even though it's just one, if it reaches this much, then we have to go to a doctor?
Yeah. So typically the cut-off point, no, wherein okay, this is a warning sign, this is something not good, 2 centimeters and up. That's the size. Okay. Another thing is if you are experiencing pain, then that's something that you also need to see your OB for.
I see.
So pain and the size. So usually it's
Yeah.
the pain first because you wouldn't go for a scan unless it's painful,
There's
right?
something wrong. Yeah,
Yeah.
yeah. Correct.
Right.
So it's the pain.
All right. Well, ladies, still encouraging. Okay. Well, for the next question, this was thrown to us privately by one of our viewers named Jade. What PPARS do you recommend for 17 creatinine level?
Oh, go.
I need to know the unit of measurement.
Mhm.
Yeah, unit of measurement. So if you can give us the unit of measurement, that would be helpful.
All right. That's a follow-up for you, Jade. I hope you could message us right back. Okay. All right. So for the next question, okay. I think it's about PPARS, no? For the powder extract, is it okay to have it mixed with lugaw or porridge or in water?
Uh, Ideally, no. All right. But if that's the only way the patient can take it, yeah. But really, we really try not to. Number one, the product has live enzyme components, so you don't want to put it to too much heat. So if your lugaw is very hot, you might diminish some of the efficacy. Okay. So what was the other option? Lugaw or
Water.
water? Sure, but the best way to do it is to actually put it under the tongue and maybe you can't taste much if you put it under the tongue. All right, your taste buds are on top. So actually, when you put the powder under the tongue, the taste won't really come out. It will be actually less. All right, and then you just take sips of water. Yeah, but don't put the powder in the water. All right. You put the powder in your mouth, and then if you want to take a little bit of water to sort of like allow it to wash down, yeah, that is the worst case scenario. Don't go any more than that. All right. Don't put it in a big glass of water, or don't eat the powder and then drink one whole big glass of water. Okay. So you want to keep it as concentrated as possible.
Excellent. Thank you, Sir Sean. All right. So for
You know
the
what? You
go
know,
ahead.
if taste is an issue, right? If taste is a real issue, maybe you can get a sweet, or something strong in taste after. Like by the Chinese, we have this thing called sanza, maybe like dried prunes or something that you can quickly get rid of the taste if taste is an issue for you. So let me know why you want to mix it in lugaw and water, right? Yeah, there must be a reason. Is it easier because the patient has difficult eating or something? Let us know a bit more. If it's just taste, then you have to learn to overcome the taste. I have asked the founder and formulator of our products, why don't you add some like flavor to it to cover the taste? So his answer is very traditional and very purist. He say, if something is good, why will you add in additives, and flavoring to spoil the thing? He said, it's the best when it's in its natural form. And that is very true. So to this particular viewer, do encourage the patient that's taking it that you're taking it for health, not for flavor. So bear with it. Encourage them. The Chinese have a saying. I don't know if Dr. Jansen grew up hearing this saying. If the medicine is not bitter, it's not going to work. So the idea is the more terrible the taste of the medicine, the better the medicine is. That has always been traditionally like that. All right. I hope that helps.
Right. May I just say that based on my observation for our clients and patients, it really differs from person to person. For some people, after taking in the scoop of PPARs under the tongue, they start to salivate. And then for some, they
It gets
tend
dry.
to, yeah, exactly.
Yeah,
So,
that's me. My mouth gets dry with the powder under my tongue. So I have to take little sips of water. I have to take little sips of water. Yeah.
I see. So there, for those of you who are taking the powder, nothing to worry about if you feel that way or you are reacted that way. All right. So for the next question, okay, how long, coming from Ms. Lara, how long is the treatment for CKD patient using PPARS?
Doc, what's your experience? before I add?
Really depends on the stage. If
Mm.
it's end stage, then yeah, can't really do anything about reversing the situation. What you can do is to try to help the patient just be a little bit more healthy or a little bit healthier. Yeah, but that's about it. No, try to fight off the inflammation. Then that's about it. For earlier stage like stage two, stage two, then definitely it can help because the number one reason why we lose kidney function, no, because of diabetes and hypertension is really because of the inflammation and the damage that is being repeatedly thrown onto the kidneys.
Mm.
So I won't say that for these kinds of patients, I won't say that PPARS would be enough, but definitely you can use PPARS as a support, no, or as a supplement to help get a better control of hypertension and diabetes, so you can get a better kidney function. Okay. Uh, for stage three, it's a little bit tricky. For stage three, what we can do with PPARS is just basically to prolong the time until you go into kidney failure. Yeah. There are some patients though in stage three kidney disease, stage three kidney disease patients who can go into stage one, stage two, stage one, even fully reverse it. You need a lot of discipline. You need diet. Okay. I won't say the specific amount of time because it really depends on where you are at. Yeah. And the situation of your body. It also has something to do with your genetics.
Mm. So,
Yeah. So yeah.
so to follow up on Dr. Jansen, I think what we can't tell you is how long you need to stay on the product on PPARS to recover, right? But I think what we can say is that within a month or within 30 days or after 30 days, you will see the improvement, right? Whether your condition stop worsening or the speed at which it gets worse has slowed down, you will feel better in general, or there is actually starting signs of reversal. So, to answer your question, what's the longest time before you can see that before you receive some good news? Then I say, on average, a month. Some people way faster than that. Some people a little bit more, but yeah, it usually will not cross 1.5 months. That's when you will start to receive some good news. Okay. Another thing is important is why is it important for CKD patients to go on the Simply Nature PPAR protocol? Or why is it important to even slow down, right? Why is it important to even take supplements and protocols, see Dr. Johnson on a diet when you're on dialysis already? Because all you need to do is just Google this. If you Google what is the life expectancy once you start dialysis, the statistics actually show 5 years. So that means anybody on dialysis, statistically speaking, on average, they live for 5 years. All right. And that's it. So you want to do something so that you don't fall within that statistics. Okay. So it's not true and it's dangerous to just think, go for my dialysis, I'll be fine. No. You just go for a dialysis, your life expectancy, statistically speaking, is the math that's talking, it's not me, right? Will say that your life expectancy is cut short for many dialysis patients. So you want to do something, right? You want to do something to improve your quality of life so that you can potentially live out your full life instead of the shortened life expectancy. And so Dr. Jansen, it has been very successful. He has been successful in delaying patients from going on to dialysis, right? Every year that you delay, that means it's another year or more that you live longer, right? That you can live a quality life. And there's even a chance that as Dr. Jansen from stage 3 to stage 2 to 1 and even better. But that's got to do with your discipline and your individual cases. So for the viewer who's asking this question and for any other persons with CKD concerns, book an appointment and consult with Dr. Jansen, right? it's a win-win situation. There's no loss, right? You're going to be able to do something to either extend your life, improve the quality of your life, or achieve reversal of your CKD condition.
Right.
Jen, Sheila? Yeah.
I just want to add that, apart from that patient, that Doc Jansen was able to delay the possibility of doing dialysis. Doc Jansen also has this patient wherein I think she was doing 4 times a week dialysis session, and he was able to drop it to just 3. So just the lessening of the session is
Yeah,
actually a
even
good
one
thing.
session is number
Yeah.
one, is the money that you save, the stress going through dialysis, another trip to the dialysis center, going through all that process. Yeah, it's just wonderful. Even if you just don't forget, reducing once a week from 4 to 3 means 54 less sessions a year. That's a whole month spent at the dialysis center,
Yes.
right? Yeah, you save an entire month. Yeah.
You know what, sir, here in the Philippines, like there's just a limited number of the government could support the sessions. So it would
Oh,
really,
so if you have more, then the rest you have to come out from your own pocket.
yes, that's right.
Yeah, so in that case, guys, anybody with CKD, please learn more about protocols. Type in questions. Our CSOs will help you. I also advise you to have a consult with Dr. Johnson. He will be able to also help you.
Yes. Once again, for those of you who wish to have a consult with Dr. Jansen Kalalan, just type in how to consult. Our caring healthcare specialist, Ms. Beth and Ms. Irish, will definitely get in touch with you. All right. So for our next question, coming from Ms. Ginger, can PPARS help with cervical spondylosis? Patient is on treatment rehab. Oh, sir, Dr. Jansen, you're on mute. You're muted. All right.
Dr. Johnson, you're muted. Yeah.
Okay, yeah. Cervical spondylosis, the problem is anatomic. PPARS won't help. Okay, it's rehabilitation, physical therapy. Yeah, that's the thing that will help you. Acupuncture, you might want to try that as well.
Oh, I see. All right. Okay. Next question. All right. For the next question coming from Mr. Christian, I have CKD and diabetes. Can PPARS powder be sufficient with that health issue?
CKD and diabetes, definitely you need your meds. Would PPARS powder be sufficient? Yeah, I will prescribe PPARS powder.
Yep.
Yeah, for this kind
Agree.
of patient.
Agree.
Next question is, do we need more? Would there be a possibility that we would need more? Yes. Depends on how sick you are. Yeah.
I see. Thank you.
So it's a good start, and if you don't see results, then have a consult with Dr. Johnson.
Right. One of the just a follow up, because one of the common question is, why don't we usually suggest or recommend PPARS liquid for CKD patient? Why is that?
Oh, okay. The reason is because liquid has a slightly higher content of phosphorus, and that's something sensitive to kidney patients. It doesn't have a lot, right? But if you're already having CKD, you just don't want to add any. You want like a zero load, to it. So you don't want to take something rich in phosphorus, still within the amount that you are able to handle every day, but then you might eat another food that's rich in that, right? So then that will cause you to cross your ideal limits. So that's why the powder doesn't have that. So it's the way the thing is extracted, the minerals are left more in the liquid. Okay, so that's why we always prefer to use powder for CKD patients. But if you have kidney cancer, that's a different thing, right? The cancer is even more, it gives you sufficient reason to go for the liquid because it's the best one, right? So again, it depends on how what illness what's your medical condition. So if you have any cancer whatsoever, especially if, let's say, the cancer is stage 3 and above, and you have CKD, maybe stage 3, we will still say go for the liquid because the cancer is a very real thing, and your kidney can actually handle the liquid. It's just that if we have given a choice, we go for the powder because it adds a zero load or very, very minimal load of the minerals onto the kidney. However, because if you're dealing with cancer, you want the power of the You want the effect of the liquid. So even in that case, we will prescribe the liquid because actually it is still safe for the kidney patient to use, right?
Alright, thank you. Dr. Johnson, would you like to add anything, or shall we proceed?
Yeah, we can proceed. But yeah, probably yeah, I'll add a little bit.
Mm.
What I also noticed, no, for CKD patients and the different PPAR products, I noticed the extracts to be more helpful than the tablets. Yeah.
Yeah, yeah.
I have actually seen quite a few patients wherein when they took PPARS, their creatinine increased rather than go down. Yeah,
Mhm.
so there are, although so far I've seen hundreds of patients, I have seen only three of them, and unfortunately I have to tell them to stop taking the tablets. So, but so far with my other CKD patients, the extracts are more tolerable. They have better response. I actually have one patient who have CKD who was taking the PPARS liquid. The patient was taking 3 vials per day.
Wow.
Yeah, 3 vials per day. Didn't really affect or didn't really increase the creatinine. Actually, the creatinine even went down a little bit. So yeah,
Yeah.
3 vials.
Okay.
So I mean, the extracts are more
Yeah.
tolerable than the
Yeah. So
tablets.
actually it
Yeah.
is tolerable. We're just playing extra safe. But Doc, I was wondering, I think the tablets, the creatinine level goes. I also understand. I also came across the rare individuals where that happens. I was wondering, one speculation. So to all our viewers tonight, this is not a definitive answer. But one speculation might be the nature of the tablet being a superfood. Yeah. So it's very, very rich in nutrients, and that might, for a kidney CKD patient, that might have a load lah, on the kidneys.
Mhm, mhm.
The next question is actually kind of in line with what your answers earlier, because the question is coming from Miss Anne. Can someone experience healing crisis even with just the most basic product, which are the tablets?
Oh, I can answer this one.
Yes.
Yes, yes, yes. Doc, I actually have people. I have a particular person who was very sensitive. That means she had a lot of illnesses. She took 3 tablets and she has headache. I don't know whether that
Yes.
is psychosomatic or yeah, but there are
It's real. It's real. It's
it's
real.
real, right? Yeah,
Yeah.
I have people. As the sicker they are, the more sick you are, the the kind of sickness is it's not cancer. I don't know why. I seldom see Doc Johnson, maybe you can also chime in. But I seldom see cancer patients with healing crisis. But if you have other problems like you are a migraine patient or something like that, actually healing crisis is more common if you are a migraine. That means you are taking PPARS because you have constant migraine and you want to get rid of the migraine, for example. I actually see healing crisis in people who just want to take PPAR for health, normal health, metabolic syndrome. They get healing crisis. But I actually, and the other one is, what's that one? Uh, Thyroid, yeah, hyperthyroidism, they have quite strong healing crisis. But for cancer patients, I actually don't hear much of any healing crisis. What's your experience, Dr. Johnson?
For patients who have mold toxicity, they really have bad healing crisis. Bad
Oh,
healing crisis. Yeah. Another class of patients, autoimmune disease.
oof,
There are some patients who have autoimmune diseases who have really bad healing crisis as well. My suspicions for those who have mold toxicity and heavy metal toxicities, the PPARS is actually pulling out
yeah,
the heavy metals. So it's a
yep, yep,
chelator. So
yeah.
once it is mobilized out from your fatty tissues, then that's the time you would experience the healing crisis because suddenly in your blood these heavy metals, these toxicities go up. Okay. So this is one of the reason. For patients who have autoimmune disease, PPARS is an immune booster. So if yeah, PPARS is an immune booster. So for autoimmune disease patients, if their immune system gets boosted, No, so they tend to have this flare-ups as well. But here's the thing, no, not all patients experience this. These patients are the minority. Okay. Most of the time, no, 8 out of 10 patients would still have a very good response. Autoimmune disease patients, okay? Autoimmune disease. For mold toxicity patients, heavy metal toxicities, we have to be careful. And I usually don't just use PPARS for these patients. I do chelation. I bombard them with vitamins and minerals to help the kidneys detoxify. Um, what else? Sauna. We have to help these individuals sweat so they eliminate the toxins faster. But if you're going to only choose a few procedures to do, especially for those who have mold toxicity, heavy metals, then chelation is very important. You have to do it consistently. Number two would be to fix your gut microbiota. So how do I fix the gut microbiota? Algae. Why? Because algae have good prebiotics. They have good omega-3 fatty acids. Number two supplement that I would use is a probiotic. Yeah. So these few things, few supplements, few procedures would go a long way.
Doc, very, very curious because I think this is the first time I've heard about mold toxicity. The heavy metals I've heard before from you also, but the mold toxicity, how do we get that? How do people get that?
Oh, that's very common in the Philippines. So any country that has very high humidity
Ah.
would have populations wherein you will see very high mold toxicity. So yeah, Philippines is one. Our air is also the air quality is also not good. So that's another contributor. Now, how do you know if a patient has mold toxicity? The patient would typically have a lot of non-specific signs and symptoms. So headaches, brain fog. Brain fog is a telltale sign. Another one would be allergies. Allergies that doesn't seem to go away, especially asthma, atopic dermatitis. You would also see patients who have gut issues. So they have frequent bloatedness, constipation, diarrhea as well. No, some even have this irritable bowel syndrome, wherein they're very easy when they eat food, it's very easy for them to bloat. Yeah, so these signs are they're telltale signs, no? So yeah, okay. In what situation will you have an increased risk of getting mold toxicity? Number one is if you are not cleaning your place. If your place has a lot of dust, then chances are you will get this. Number two, if you are living in a place where you have a lot of things that are quite old already, decades old, furnitures, you have to replace them because underneath those sinking sheets would be molds growing over decades, and you are getting exposed to these elements. Right? Okay, so that's how you get mold toxicity. Yeah. So cleanliness is very important. If your furniture is decades old, please replace them.
I mean, as a mom, right? Yes, sir, Sean. You
No,
have
I'm just saying. So yeah, if you're an antique lover, please spend money to have your old furniture, refurbished, cleaned and things on. I want to just add that don't forget, healing crisis is not it's not a negative thing.
Yeah.
It's actually a good thing. It's the healing process, right? It's the part where the things that are not good is coming out. Just like LBM is not necessary. It's a bad thing because you are going to work or you're in your office. It's very inconvenient, but it is a good thing because the poison that you took from the food poisoning is coming out of your body. So understand healing crisis like that. But again, don't take healing crisis lightly. Don't just say, oh, I'm experiencing healing crisis, I will just soldier it through. I think when you're going for healing, when you are experiencing healing crisis, if it's more than four days, for example, arrange for a consult with Dr. Jansen because you don't want to mistaken allergic reaction with healing crisis. Or another thing that is very interesting is that, for example, a patient who's taking PPAR tablets to lose weight, for example, right? He takes the product and suddenly feels pain in their one part of their organs. It is my experience that every time that happens, it's actually an indication that that particular organ that has pain, that you are experiencing pain, is weak. All right. So I give you one example. I have a friend. She was right beside me when I was taking out my pipa powder to eat, my powder extract, and she takes the tablet. So she looked at me and said, "Can I try your powder extract?" So I gave her a scoop. That night, her breast was painful. Okay, but she was not surprised. Why? She had a mastectomy before, so there is an old wound on her chest for where the surgery was. The wound actually ached, so there was some pain. So it's because when you take PPAR, it's like we said, it's a cell activator, it's cell food. So the body is going to like heal, right? So it's going to repair. So it's also some pain in it. So again, healing crisis is not necessarily a bad thing. Many times it's a good indication that your body is experiencing healing, is trying to fight back. Okay. But don't take it too lightly also. Don't say everything is healing crisis. Sometimes it's not. Sometimes you really have an issue. So always be prepared when you're taking any supplements, not just PPARS, any supplements. When you have certain reaction, have a consult with Dr. Jansen, right? Go and see a doctor, which is why we have this program, right? Is to help you understand. And with that, I want to segue to Ms. Evelyn Gelming. She says that, good evening, is PPAR Plus not recommended for hyperthyroidism? Because she's asking a question, I assume. I stopped taking it upon the advice of my endocrinologist because PPAR is made of seaweed. So I'm going to thank you, Ms. Evelyn, for sharing that comment. And I'm going to take this to how shall we say, answer or elaborate on two items here. Okay. The first one is this. This is why sometimes patients and clients of our PPAR protocol or other health supplements get confused and frustrated. Why? Because good things about the supplements, and then the doctor tells them don't take it. Okay. And I want to say always, your doctor has his best intention. He is trying to protect your health. Now, I'm going to show you, this is a perfect example where the doctor means well, but his advice is not accurate. The reason is because here he says because PPAR is made of seaweed. Okay. Why would a hyperthyroid patient why would the doctor tell a hyperthyroid patient not to take anything that is made from seaweed? Because for hyperthyroidism, iodine is not good for you. You don't want to take any iodine, right? Now, seaweed has a high level of iodine, as in like very high per gram. Okay, so it's an abnormally. So if you take seaweed, you're definitely going to cross your recommended iodine level for a hyperthyroid patient. So taking seaweed is a no-no for a hyperthyroid patient. However, microalgae like the ones in our Simply Nature PPAR, including the very other common algae, spirulina and chlorella, is very low in iodine. And the reason is they are not seaweeds. They are freshwater algae. Algae is not seaweed. It's two different things. But of course, a doctor is not a specialist in algae and seaweed. They are specialists in their specialty, endocrinology, right? So they are not botanists, they're not marine biologists, right? So this is not their area of expertise. So this is a perfect example where the doctor really does mean well, and we truly understand, not upset at all, support the doctor for looking out for the patient. But this is where you need, as a client, as a patient, that's why we have this program, so that you can ask, right? And if you ever want us to speak to your doctors, we actually have an entire company that deals only with medical doctors, like Dr. Jansen. So we will have med reps to go over there and help explain to them what's the difference, why is it okay for hyperthyroid patients to take PPAR protocol. Okay, so again, for spirulina is actually very low content of iodine. For chlorella and our microalgae, it is actually considered zero, right? It is so negligible. It is that means most country all over the world you can actually put down there zero iodine content. Okay, so for this particular viewer, thank you so much, Evelyn, for bringing this wonderful point up to allow me to illustrate, right, why your doctor, with his best intentions, may give an advice that's not totally accurate. All right, it's because they have a misunderstanding of the nature of the supplement. Again, no fault of theirs, because they don't, it's not their specialty. All right, and it's not their responsibility to go and find out what's the difference between seawater, seaweed, and freshwater algae. They're not marine botanists, right? So this is the thing. Now, I do want to highlight something. It is my experience with all the patients. For me, so far, almost 80 to 90% of hyperthyroid patients, okay, who take PPAR protocols will experience a healing crisis, and they tend to be a bit more on the serious side, right? So there's two options. One is to go really slow, all right? That means you take low levels, low concentration, and then you will take a longer time to see the results. So the body slowly regulates it, right? And gets used to the correction. The other one, which is only advisable if you have, like, if you consult Dr. Jansen, right? And if he's comfortable to say, okay, you take this dosage, be prepared to feel feverish, be prepared to do all this, take medical leave, be prepared to take medical leave for the first 2-3 days, just in case, you know, you might have a very serious initial healing crisis. And you also have your doctor on hand so that if the fever lasts more than 3 days, you know, he'll be there to give you advice on how to proceed. So yes, I do agree, for hyperthyroid patients who take PPAR protocols or any supplements, actually, they tend to have quite serious healing crisis, okay? Especially if the protocol is going to work for them, okay? Because the entire process of dealing with a hyperthyroid issue, you will tend to have healing crisis. And when you take drugs, it actually does the reverse, right? You become hypothyroid, and then you gain weight and you feel very lethargic and so on and so forth. So it's not an easy medical condition to treat, right? So it's something that you have to monitor and adjust. So like I said, for this particular class of patients, I would advise that you go for a consult so that you have a doctor with you. But the good news is I had friends. I literally had friends. Okay, these are friends who had hyperthyroidism, and taking Simply Nature PPAR protocols, they were able to bring that under control. All right, they still have to watch themselves. They still have to be careful, but they can actually. The one that I'm thinking of, she actually, her medication is kept as an emergency, right? So she was able, after some time, to be able to be off the medication, but she always still carries the medication in her home. She does have it available. All right. So again, I will leave this because this is a more difficult thing to monitor. I will leave it to Dr. Jansen. Go for a consult if you're a hyperthyroid patient and you want to explore natural means of dealing or managing your hyperthyroidism condition. Okay. Yeah. Thank you.
So yeah, I just want to say once again, for those of you who wish to have a consult with Dr. Jansen, just clearly type in how to consult. Miss Beth and Miss Irish will definitely get in touch with you. All right, for our next question, it's a little bit sensitive for the ladies because the question is, can PPARS help for erectile dysfunction?
Oh, before
Yeah.
Dr. Answer, yeah, he's nodding his head. The answer is yes, because it attacks or solves it manages many of the root causes for erectile dysfunction. I'll leave Dr. Johnson to talk about this.
Yeah, okay. So erectile dysfunction, guys. So what happens, no? So normally, how will the penis get erected? Okay. So the penis is an organ that is very rich in blood vessels. So for the penis to get erect, it has to be engorged with blood. Okay. So, if you have blockages or microclots, micro blockages inside the blood vessels of your penis, then guess what? You will have difficulty um, getting an erection. So, blood will have difficulty going inside your penis, okay, to fill it up. So, the answer to that is no to declog the blood vessels of your penis. So what we're doing here is actually addressing metabolic problems. So if you have heart disease, if you have high blood cholesterol level, if you have a high triglyceride level, if you have very high
Diabetes.
inflammation, you have diabetes, yeah, that's a very important disease to address as well. If you are a smoker, okay, smoking can damage your blood vessels. Um, yeah, if you have issues with your hormones as well, no? But for the hormones, it's gonna be a different approach already. But the ones, at least those that I have mentioned, no, PPARS would greatly help. Okay, because inflammation is front and center in these issues. By lowering inflammation, addressing the high cholesterol levels, addressing the microclots, then definitely you would be able to recover some function down there. Okay, so don't lose hope. No, there's hope with this. Now, if your issue is minor or it's mild, I think PPARS would help a lot already. But if I'm going to choose, no, what protocol would I give a patient who has erectile dysfunction, at least in the beginning? I would choose the tablets and the soft gel. Yeah, so those two. Now, if, say, for example, you still don't have any improvement after taking it for a month or two, then we need more intervention. So you have to see me. Okay, there are a few interventions that we can use so that we can try to get some function back.
Some result.
Okay?
I want to encourage this particular viewer, right, who asked. I actually have clients and patients, right, that actually are so happy because and almost I think 9 out of 10 of these patients are actually diabetic. So they become very happy because one of the first things that they notice that their blood sugar is they actually were more happy because they were very happy, not because their blood sugar came down. It's because the erectile dysfunction was starting to, yeah, they got the flag to raise again. So that was the happiest thing. They totally forgot about their blood sugar level after that. They were just so happy with that result. All right. So yeah, please, as Dr. Jansen mentioned, there's a good chance. So why don't you start on it? Yeah.
Just a curious question. I don't know if should ask this. Is there like a usual age range for this one, or does it affect all ages?
No, it's all ages got to do with your underlying core morbidities. Yeah.
I see.
Yeah, underlying comorbidities. But erectile dysfunction affects men who are in their 50s and up. 40s, not so much, but there are. And if you are someone who's experiencing erectile dysfunction in your 40s, then that's really, really bad news. Yeah, you definitely need help if you're experiencing this at 40.
Well, it's an encouraging answer to both the men and the ladies out there, as I must say. So for the next question coming from Miss Awi, currently the patient is on chemotherapy for recurring cervical cancer stage 4. What is the expected outcome or effect once the patient takes the liquid extract and the tablet?
Doc, you want?
Yeah.
From the technical aspect, right? What you will see is that I'm sorry, Sheila, I missed it a bit. Could you just repeat the question again?
Sure, sir. The question is, currently the patient is on chemotherapy for recurring cervical cancer stage 4. What is the expected outcome or effect once the patient takes the liquid extract and the tablet? So they are combining both the conventional and
Yeah, so one of the things is you should be able to undergo your chemotherapy with I guess less side effects. Your body should be stronger It's not saying that you will have no side effects, all right, but you'll be able to weather it better, and perhaps it won't become really terrible. Another thing that it will help with is really the RBC count, right? Your red blood cell counts and your white blood cell count. So those are the immediate things that you can feel, because the moment you take chemotherapy, especially if you are sensitive to the chemotherapy that you're taking, you will feel the negative effects of chemotherapy. So this will help you mitigate. If you're taking the PPAR protocols and your chemotherapy and you feel nothing, then great news, it's working, right? The PPARS is helping you go through chemotherapy as if it's nothing, like you don't feel any of the negative side effects. But if you do feel it, then it's also doing the work trying to minimize the impact on you. It will definitely help you with your recovery. If yours, if in between your cycles. So for the details, I will leave it to our expert, Dr. Jansen, who actually has many patients that he takes care who are undergoing chemotherapy. Doc?
Yeah, so some expected outcomes, well, definitely it would be a very big help to complete the entire chemotherapy protocol. Another thing that is that I usually observe in my patients, no, the patients are stronger. So, they recover faster in between chemotherapy cycles. Yeah, so that's also what you want, no? Because if the patient's body is still down, no, because of the previous cycle, the onco will not push you with the next, because we need to allow more time for the body to recover. The thing is, our genes and depending on the patient's age, are the amount of time to recover from any injury, okay, may it be physical or chemical, it's going to take a longer time if the patient's age is, older. This is also true if in the family, there are a lot of diseases. So you will notice this, no? If in the family you have different diseases, then it's really prevalent on every level of the family, or on every generation of the family. Then expect the patient to have this as well, longer time to recover. So definitely with PPARs, no, it would really help these kinds of patients, because you can get a shorter recovery time. So if the recovery time is shorter, then you would be ready for the next cycle of the chemo. So you would finish the chemo on time, you would have less side effects, and quality of life would just be better.
Yep, there you go. So
Thank
the best thing that you will experience is if you feel nothing, right? Because when you go for chemotherapy, it's usually not the case that you feel nothing. And since this is a recurrence, I'm sure you've had experience with chemotherapy before, so you should be able to tell the difference now that you're doing it with PPARS. And usually, again, since this is a recurrence, the drugs that you're using now is probably different and definitely stronger than what you used to use. Yeah, correct.
Thank you. But I just want to quickly add, the one of our focus here in Simply Nature is for you to have a good relationship with your doctors. Apart from the fact that once you have started off with your chemotherapy, you want to be always on track with your schedule. So because the more on track you are, of course, the faster you also finish. All right. So I guess this would be our last question for tonight. This this cleansing plus have a laxative effect?
Yeah. Yes, the answer is yes. Whole point of cleansing plus is to make you poo. How does it make you poo? It uses psyllium husk. No, the main ingredient of cleansing plus is actually psyllium husk. So for psyllium husk, how does it make you poo? It bulks up your stool. So the bulkier your stool is, the more that your intestine can push it down and out. No. Another one is to basically increase fiber intake. So that's to feed your gut microbiota. So a better gut health, or gut microbiota health, then that would also mean better bowel movement. Yeah, so some patients who experience constipation actually have gut dysbiosis. So gut dysbiosis is the medical term for you have bad gut microbiota. Okay, you have a lot of bad bacteria inside your gut. That's why you're experiencing constipation. So this is one way for you to have instant bowel movement, instant defecation, okay? Also to feed the good bacteria inside your tummy and to, eventually address or push your gut population to the good one. Okay? So that's the role of cleansing plus. Also another one, no? This is actually not um related to constipation or anything of of the sort. Um, if you have a higher fiber intake, no, in general, you would have better digestion as well. It would also take a longer period of time for you to absorb the nutrients, which is good because you don't want your blood sugar to spike. That would lead to insulin spikes and eventually leading to crash. So for those of you who are drinking plenty of soft drinks or three-in-one coffee, no, and then afterwards you experience a crash. That's the reason why. Um, okay, for patients who have high cholesterol levels, that's also one way for you to naturally be able to decrease the cholesterol, your blood cholesterol level. So, cholesterol is eliminated through the stool, and the more fiber that you eat, the more sponge that you will have, and the more you will have more of something that will hold cholesterol and for you to defecate it out, eliminate it out, excrete it out. Okay, so that's how.
Thank you. Thank you, Dr. Jansen. Sir Sean, would
Yeah,
you
I
like
just
to add
wanted
in?
to add that I use cleanse every Friday night. All right. So yeah. So as not Dr. Johnson, does it have a laxative effect? The answer is yes. So you might ask, I know. Okay, guys, I go even without cleansing plus, I go about minimum twice a day. Right? In fact, my wife always complain, why am I going to the CR so often, right? But then if I go twice a day, every day, why do I still take cleansing plus? Okay, so I'm gonna go a little bit into TCM, traditional Chinese medicine, but I think I'm gonna do it in a way that everybody can understand. Um, have you ever felt like constant like warm buzz or hot temperature? Like for example, you ate too many chocolates, right? And then you feel like Meron inflammation. Maybe you associate that feeling with inflammation. You feel like a sore throat coming, that kind of feeling, like your body's warm. You need the air conditioning. If not, the weather's really hot and nobody else is hot in the house. Okay. So in traditional Chinese medicine is saying that you have damp heat. All right. You have damp heat. And in order to pull that down, right, you have to pull your damp heat downwards, right, down from your lungs. And that's why you get sore throat and things like that. You got to pull it down from your lungs. You got to pull it down into your bowels, right? And pull it out. Okay, so I don't take cleansing plus because I'm irregular. I take cleansing plus every Friday because I still have this issue with damp heat. So you need to pull you have to really pull all the toxins and feces out of your system. And every time, I'm sure for everybody who has used cleansing plus before, the next day you feel light, right? After going, my face, like if you see sometimes people say I have very rosy complexion. Actually, TCM, my complexion is a little bit too red, right? I have excess heat. Okay, but if I take cleansing plus, you will see my tone of my face actually go one shade lower. It's like the heat is pulled out. I feel more balanced and happier. So I actually take cleansing plus not because I am irregular. I'm actually very regular, but I take it because I need to pull that extra toxins and heat that is stuck in my system down. Okay, so when I take cleansing plus, if I'm healthy, that means everything is good. My poo-poo is normal. But most of the time, I've been naughty during the week, especially if I meet clients. We have to go out and eat, and I eat cake and things like that. Things that at my age of 51 shouldn't be eating too much of anymore. Then on Friday nights when I take Cleansing Plus, the next morning at Saturday, the poo-poo that comes out is, I'm sorry to gross anyone out, right, is definitely very dark in color, right? Almost very dark brown, close to black. And it's usually acidic. How do we know? Because it is not formed nicely. It's like splattering, right? So normally, if I don't take Cleansing Plus, I won't have this normal poo-poo. But if I take Cleansing Plus, it's actually like that. And then I can actually feel the damp heat being drawn downwards and out of my system. So I just want to share with you, yeah, it does have that effect, right? Even if you're regular, it will actually enhance or make it stronger, that laxative effect. But I also know many clients and patients. I have some patients, some clients that have to take 2 sachets of Cleansing Plus to move. So it really differs from person to person. So I'm merely sharing my story so that it's a reference point. It could apply to some of our viewers, right?
And thank you, sir. I just want to echo out what you both said about this question, because it's a common thing that our buyers buy this to be sexy, to stay in shape, but it's actually, there's a lot more into it. And this is also the very reason why Doc Jansen is including Cleansing Plus in his protocols for different illnesses. So thank you. All right. Actually, that is our last question for tonight. Wow, we finished everything. Okay. So you're on mute, Sir Shyan. You're saying something? Oh, you are muted, Sir Shyan.
I said I saw Miss Christine Bannock's question, and she's a diamond viewer, so I can't ignore her, right? How can PPARS help CKD patients? Basically, Doc, how would you answer this? The short answer, yes, it's going to help the CKD patients. It's going to help the root cause to CKD. So potentially, if you deal with the root cause, you can reverse the early stages of CKD. And if you're already in the late stage CKD, it can slow down the development. And if you are already on dialysis, it can actually improve your quality of life and extend your life expectancy while on dialysis. The best case scenario that I've heard and encountered is actually not here in Philippines, but in Taiwan, because our product is originally formulated and produced in Taiwan. So it's been there longer than in Philippines. So there is a dialysis patient that has survived 30 years plus of dialysis. So senior citizen already, and he has a normal lifestyle. So he doesn't have a limited lifestyle of most dialysis patients. He eats quite normal food, normal as in, yeah. And the reason is he's been on a PPARS tablet ever since day one of his dialysis. So with the PPAR, he's not even soft gel capsule, it's just PPAR tablets from day one. Since he started from day one, he probably, that's another reason why if you are late in the game, then you probably have to take soft gel capsules, to have the impact. But he took it, I believe he might even be a PPAR tablet consumer before his dialysis. So with that, he actually maintained a very good quality of life. So that's to encourage and to answer Ms. Christine Bano. So thank you very much.
Excellent. Thank you, Sir Shyan. Dr. Jansen, would you like to add anything?
I think Sir Shyan answered it well. PPARS helping CKD patients to address the root cause, to address the risk factors why the patient has CKD in the first place. So if it's hypertension, diabetes, those are the two most common ones. So inflammation is always central to these two diseases. So you address the inflammation, you would be able to improve the kidney function. Yeah. So of course, it goes beyond just PPARS. So we're just talking just PPARS alone. Definitely you would need other things. So these things, how would you know what to do? You have to go see your doctor. Okay, but PPARS in and of itself, that's how it would help patients who have CKD. Okay, it's really the inflammation.
Okay, so once again, I've seen how Doc does his consults. He digs deeper into what medications you are taking, whether it's prescription or other supplements. So if you're interested to have a consult with Dr. Jansen, just simply type in how to consult. Miss Beth and Miss Irish will message you individually. Right, so, well, it looks like we've covered all our questions tonight. As we wrap up this evening, we'd love to hear your final thoughts for our viewers out there. Who would like to start? Doc Jansen.
I'll start first. I'll start first. Yeah. Thank you everyone for all of your questions. Questions are still really, really very interesting. We're both learning a lot. You guys asking all these questions, we're also learning from you. Okay, so keep them coming, and I'll see you on the next webinar. And most importantly of all, see you on June 7. June 7 is 2 weeks
correct.
away. So I'm just wondering how the team of Simply Nature is organizing the event. I think you're quite stressed out already because it's 2 weeks
Yeah,
out, no?
they're
But
always stressed about attendees. Yeah. You know, I I just want to say, guys, come on, get out of the house, right? I know the nice thing about doing the Facebook Live is it's so convenient, right? That you don't have to take. But we chose SM Aura in BGC for a few reasons. Number one, if you are Filipino and you seldom come to BGC, you're missing one of the most beautiful cities in your country, right? You come here, it feels like you're in another country like Singapore. It's even nicer than Hong Kong, okay? So and next, we chose SM Aura because SMX Aura is at one of the nicest SMs in the country. And they have a very nice food court and all the restaurants. If you want to spend a little bit more, they even have theater. IMAX, the few IMAX in the country is here as well. And if you like something more, how shall we say, rowdy and exciting, there's Market, which is an Ayala Mall. They have this open market area, and of course, it's another huge mall. So it's actually a whole day of activity. So if you're coming from slightly further away, from Cavite or somewhere else, it's nice. You can bring your whole family after the conference. You can have lunch together with your families, spend a few hours in the area before you go home. So it's literally an activity day. But of course, the real draw is seeing Dr. Jansen live in person.
wait,
All right.
I'm going to share something that would draw you guys in the face-to-face event as well. In the face-to-face event, I'm going to talk about things or solutions for patients who don't know what else to do. Okay, you are either limited by the tech know-how of the doctors around you taking care of you, or you are limited by the availability of tests. Okay, so with these, no, I'm going to talk about what to do if, say, for example, you want to be more proactive in addressing cancer. I mean, early detection is going to be the still most important way to win against the battle for cancer. Say, for example, imaging studies come out negative, but you're still worried that there might still be something. What else can you do? So I'm going to discuss that there. The only way for you to know this is for you to go for a consult, not during the Q&A. Not during the Q&A, because the discussion is very long. We're going to exhaust all the time of the webinar, so it's not the place to discuss this. Another thing, say for example, you are in a situation wherein your oncologist and your other doctors seems to do an experiment on you. They're trying different things. See, nothing seems to work. What else can you do? Yeah, to help your doctors. Okay, so I'm going to also discuss that in the face-to-face event. Okay, so I highly encourage you to attend, fill up the seats. It's 2 weeks away, so it's going to be a very exciting day, a lot of learnings. So I'll see you on June 7. Okay, so I'll give the floor to Sir Jhen.
Guys, I want to tell you, I haven't seen Doc Jansen so excited to do a presentation.
Yeah.
So I think these are the learnings that he's accumulated over the last 6 to 8 months. He's been traveling overseas, attending different conferences, and I think he's excited to share. All right, so that's a very attractive thing. So again, like I said, we are always here with you from start to healing. We made this program available. Tonight, we really covered quite interesting questions, and we were able to have live example of why a doctor gave an advice out of him wanting to benefit his patient. But again, this was a perfect example. The doctor actually gave a reason, and that reason is not correct because he doesn't have the right product information, right? So this one is about thinking that the PPAR tablets contain iodine, which is a safe assumption because most people who are not into this particular type of like Simply Nature PPARS were mistaken algae for seaweed. It's basically plants that grow in the water, right? So they think it's seaweed, and the doctor is correct. Seaweed is extremely, very high in iodine, but actually microalgae, freshwater microalgae are like Spirulina chlorella, and our proprietary algae is actually it's actually labeled as 0 iodine. It's so low that it's negligible. So it's actually safe for hyperthyroidism. So this is another good example of what we try to do on the program. And we thank you for being here with us, learning together with us, giving us opportunity to better understand doctors as well and help you understand doctors as well. So again, as Dr. Jansen said, not only am I going to be there, Dr. Jansen is very excited with a presentation he wants to share, but there is also going to be Dr. Jimmy Katapia, one of the top surgeons in Metro Manila. So he can answer all your surgical questions, all right? So it's going to be the most exciting Ask Me Anything segment that you can have. And it's live. And what's nice is that you get to hear other people's questions being answered, and you can follow up on it straight away and interact, okay? So come in person. 7th of June is a Saturday, 2 weeks from now. I look forward to seeing as many of you as possible. Okay, thank you very much.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Now, on behalf of our patients and viewers, thank you so much to the both of you for answering our questions for tonight. And we are looking forward to your answers, of course, next week. Now, thank you once again for joining us. Remember that taking action in your cancer journey or other health battles is a powerful step forward healing and strength. We hope that you felt empowered to make informed decisions and take control of your path forward. Now, if you or your loved one is battling any type of cancer, any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So do not forget to like and follow our Facebook page, Simply Nature International, and Dr. Jansen Calala's FB page, Simply Healed Medical Group, and subscribe to our YouTube channel. This is for you to be also be informed and updated with our latest promos and events. All right, I have another new announcement because you can actually elevate your organizations for the companies out there and organizations out there. Elevate your organization's wellness initiative by partnering with Simply Nature International, your trusted expert in holistic health and nutrition. Whether you're planning a seminar or a webinar, Simply Nature delivers science-backed, engaging, and transformative wellness experience that inspire positive lifestyle changes. Now, with a dynamic team of health advocates and access to cutting-edge natural solutions, we tailor each session to align with your organization's goals and values. So empower your team with the knowledge and tools to live healthier and more vibrant lives, because you are also investing in higher employee engagement, reduce absenteeism, and more energized, focused workforce. Now, let Simply Nature help you to create a culture of wellness that drives success from inside out your organization or company. Now, listen carefully because I have some questions. Can biopsy make cancer spread? Or is your body strong enough to survive the surgery? Well, we are calling all cancer patients, survivors, and advocates, and yes, even doctors. This is your moment to gear up and reclaim your freedom from fear and uncertainty of illnesses. Happening this June 7, 2025 at SMX SM Aura at 8 a.m. is the face-to-face Simply Nature Health Seminar entitled Freedom from Cancer, Latest Strategies, and live panel with leading experts. Now, our panel of experts is composed of PPARS expert, lifestyle medicine doctor, integrative doctor, and surgical oncologist. take advantage of the face-to-face AMA portion where you can ask our questions live in the flesh during the live event. Now, tickets for the face-to-face, and yes, for those of you who are living outside NCR or quite far from Metro Manila, we are opening our tickets for the Zoom setup. Okay, so you can watch the seminar via Zoom. Now, these tickets are now available too, so please contact your assigned HCS or healthcare specialists and client service officers for more details about this, because you can now buy your tickets online through website and directly from us. So what are you waiting for? Buy your tickets to this exciting event right now. Okay, another exciting news, you are in for a treat because we have an exciting lineup of promos exclusive for direct and website orders only. Because if you buy a box of PPARS liquid extract, you will get a free bottle of PPARS tablet that is worth 1,950. Another one, if you buy PPARS powder extract jar, you will get 5 sachets of Cleansing Plus for free. Guys, that is worth 800 pesos for free. Another one, the most exciting one, if you buy 3 individual packs of soft gel capsules, we call it banig, right? You will get extra pack or extra banig of this PPAR soft gel capsule, which is worth 3,700 online. Okay, so amazing, right? Once again, this promo is up until May 31 only. Okay, so experience the benefits of PPARS at an unbeatable price, because now is always the best time to get the best help, not only for yourself, but of course for your whole family. Now, another exciting event next week. Next week's episode is the Simply Healed webinar happening on May 29th. That's a Thursday. It is entitled Support and please watch out for the title of our next webinar this coming May 29. That's another same day, Thursday, same time, 7:30 p.m. Okay, so once again, thank you so much for spending your time with us, because your commitment to healing inspires us. Remember, every step that you take is a step forward, and you don't have to walk this journey alone. This is Simply Healed webinar powered by SMG and SNI, because your curiosity about your health condition and your victories over cancer and metabolic illnesses are what keeps us going, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all. See you next week. Bye.
Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer. We will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're going to have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPAR protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen the top specialist in supporting cancer treatments. All 3 of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th at SMX Aura 8 a.m.